Hi, I'm Kira. I am going to demonstrate or verbalize a soap stud enema administration. For that procedure, you would use a 1,000 milliliter bag and fill up maybe about 500 milliliters in the bag of warm water, and you would test that just with the elbow or your hand, just to confirm that it's warm. It's not too hot, not too cold. It will be comfortable for the patient going in. And then you would usually the doctor gives you how much to give, but you would take the soap studs in the packet and you would mix it up in the bag, and then you would take at the end of the bag, they have like a blue tip. You would take that tip and lubricate it, and once it's lubricated, tell the patient, so you're all set, tell the patient what you will be doing, and go ahead and glove up usually for that, like hand hygiene and everything. And then have the patient lay on their side. So if they're laying on their left side, then you'd have their right leg bent, and it just kind of helps guide the fluid in a little easier. So when they're laying like that, you want to inspect the area first, make sure there's no hemorrhoids, there's no bleeding, there's nothing that would prevent you from putting anything, from doing the enema. And then as you are ready to go, then you would just take your IV bag and you would hang it up on the pole. You'd get a bunch of towels and drapes and maybe even a gown for yourself, depending, just kind of keeps everything all clean, you protected, because it could be messy. So once you have all that going, and you inspected everything, just take your end of your tube, make sure it's lubricated so they're comfortable, and then you'll insert it for about 3 to 4 inches. If you get resistance or the patient says it hurts, just stop, and you can always just try again. And then, so like once you insert it 3 to 4 inches, then you're just gonna hold the bag about like 12 to 18 inches above the rectum, and then kind of hold on to the clamp and release the clamp, so that way the fluid flows. And you're probably just going to hang out there for a couple minutes as that all that fluid goes in to the rectum. A tip that I was giving was if they say that there's pressure when it's going in, you can stop the bag for 30 seconds and then resume, but just do it slower the second time, if they complain, I guess. And then once the fluid's all done, and it's absorbed there, you would take it out, kind of clean the area, any stools on there, and then you would just throw the enema away. You'll tell the patient to hold the fluid for about 5 to 10 minutes, just so, because the solution's the most effective at that time, and that's what's really going to help break up their stools and help with that constipation. And then they're able to go to the restroom. And then when they do, you obviously want to inspect their first bowel and see if another one is needed, or if that was what was helpful. So, and that is how you would do a soap stud enema.